I'm Dwayne Brown. Tonight on KPBS Evening Edition, a vote on health care reform, a new man in charge of the San Diego Padres, and a battle over email in the North County. Plus this.
You know, we love you and we miss you and we want to help you.
A Spring Valley woman is searching for her son. He's mentally ill, just out of prison and missing, and she says it didn't have to be this way.
I'm Peggy Pico. San Diego County District Attorney Bonnie DeManis and County Sheriff Bill Gore joins us with details on what's being done to prepare for hundreds more felons likely to be released into county custody. Then, it's that ComicCon time of year again as stormtroopers and pop culture heroes troll downtown streets. We'll show you what's new and how to get the most up-to-date tips on navigating this year's ComicCon convention.
And another season of fancy hats and fast horses underway at the grand opening of the Del Mar races today. KPBS Evening Edition starts now. Hi, good evening. Thanks for joining us. The House has voted to delay two core provisions of the president's health care law requiring all Americans to get insurance and businesses with more than 50 workers to provide it. The White House had already announced a one-year delay for the employer mandate and says today's vote wasn't needed. This is the 38th time House Republicans have tried to eliminate, defund, or scale back the law. Today's legislation is expected to fail in the Democratic-controlled Senate. A wildfire in eastern Riverside tonight has burned more than 22 square miles. The mountain fire is burning between Hemet and Palm Springs, where temperatures are in the triple digits. Humidity is as low as 1%, making it very dry and dangerous. Several homes and other buildings have been destroyed.
Lived here for 30 years and built my own with my own hands, uninsured, paid for. Everything in the world I own is gone.
At least we got all the animals out and all the families, so everybody's fine.
50 homes have been evacuated, and so has a camp for children with cancer. San Diego Padres have a new president and CEO. Mike D. worked for the Pods from 1995 to 2002. He calls his return to San Diego a homecoming. Joining us with more on the front office change, KPBS business and environment reporter Eric Anderson. Eric, what did Mike D. have to say when he talked with reporters today?
Well, Dwayne, he said a lot of what you would expect from the president and CEO of a Major League Baseball team. He's committed to winning and leading the team to the top of the National League West. He called San Diego a great sports town, and D did speak reverently about his time here. He said he remembers touring the region with that trophy earned by the 1998 championship team, which lost to the Yankees in the World Series, and he was impressed with the Padres' ability to unify the community. The Larry Lucchino protege says he's going to focus on building that kind of relationship with San Diego.
Community was what Larry believed in, and we built the entire business and the bones of the business on making sure that we connected to the community in ways that I think the city perhaps at that time hadn't seen in recent years.
Now, D says he had an immediate connection with the ownership team, and he looks forward to restoring the championship luster here. Incidentally, D was also quick to point out that he's not ready to give up on this year's team. He says there are only 8 games out of first, and there's still a lot of baseball to be played.
Well, Eric, it seems like his hiring happened pretty quickly. How did he rise to the top of the list?
Well, a member of the ownership team, Ron Fowler, says he's known D for 18 years, and he says he's always been impressed by his energy and the excitement that he expects to create here. Another owner, Peter Seidler, said that D will help the team win ball games, and he says it was a clear choice. The second-place candidate for the job was way down the list.
KPBS business and environment reporter Eric Anderson. San Diego's new Central Library is a few months away from opening, but its special event rooms are already getting booked up. The new building will have several spaces for special events, and library officials say they have tentative bookings through next year. Rental fees could bring in $150,000 this fiscal year. The new library is set to open September 28th. Several hundred state prisoners may be heading to San Diego County in the next round of prison realignment. Peggy Pico has an update from the county district attorney and sheriff.
Another 400 to 800 state prisoners could be released into county custody by the end of the year as part of a federal mandate to reduce prison overcrowding. But this time, county officials fear the incoming prisoners could be violent or sex crime felons. Joining me with further details is San Diego County District Attorney Bonnie DeManis and San Diego County Sheriff Bill Gore. Welcome back.
Thank you.
Thanks,
Sheriff Gore, how are county jails and probation programs preparing for this possible new influx?
Well, we've been dealing with realignment for 18 months now, and the state has already downsized their inmate population by 30,000. So this is the last 10,000, and what we're saying is we don't think there should be an artificial deadline of releasing them by December 31st. If they're forced to do that, that could mean an influx into San Diego County of 400 to 800 new people either on parole or probation. They're not going to be sent to my jails. They're going to be put out in the community under the supervision of county probation. So I see the biggest impact from the county perspective of being on county probation right now.
So county probation is one thing, but Bunny, now Governor Brown, he's asked to delay this, as have a lot of people.
We support
absolutely
that.
Saying, listen, 10,000 people statewide, 400 to 800 here. By the end of the year, too much, too fast. But if he's unsuccessful, if this truly goes forward, what kind of impact will it have on our courts and other systems, like our medical system, things like that?
A huge impact. We are already having to add 2 attorneys. Public defender's going to have to add, and the court's already been drained of their resources. So it's stressing the system, on an arbitrary date when we're already stressed.
Right, sequestration cut quite a few court.
Well, it's the state.
State, that's absolutely
true. The state
true.
was cut by a huge percentage, and they closed down 10 courts. So it's going to cause a lot of problems in terms of public safety from our perspective, because people will be on the streets that are unsafe.
And Sheriff Gore, now realignment was supposed to be, and originally was for nonviolent criminals, as they told us. But now, why may not that? How come that couldn't be the case this time?
The Supreme Court ordered the downsizing by 40,000 inmates. It looks like they're not going to be able to meet that goal. They're at 30,000 now, and if they're forced to do this 10,000 additional cut by the end of the year, they're afraid they're going to have to cut into the serious and violent offenders, releasing them from state prison before their sentences are completed, putting them back on the streets. And if the state inmates run true to form, 70% of those will recidivate within 3 years. That's got to impact the crime rate in San Diego County. So that's our big concern overall, is public safety and keeping the crime rates down.
Let's talk about that, Bonnie. Since this has been going on since October 2011, how has the crime rate been in San Diego? Has it influenced? Have we gone up or down?
Absolutely, we've gone up. We've seen an increase in our cases, 30%, 25 to 30%. So we're seeing it. And we're going to see it more if they do a dump in December.
Yeah, and I'm sure there are some things, though, even though it's the term dump has come up, that you're just dumping this on us and we have to handle it. But you've done some preparation. There's some houses to help people not recidivate. Well, tell us about that.
If we're going to be successful on this, we've got to lower the recidivism rate. That I said the state has a recidivism rate of 70%. We've got to bring those numbers down. And you do that by giving them the tools they need while they're in our custody. Our inmates, we have 1,600 inmates now of the realigned population, and we're going to have those for longer periods of time. To me, it's a wasted opportunity if we don't get them the resources they need to hopefully be successful when they get out. And I say resources, substance abuse programs, anger management, literacy programs. So when they leave our institutions, which 95% of the people who go to jail and prison are coming back to our communities. So to me, it just makes common sense to try to give these people the tools they need to go out and be successful. And then we have to work hard at transitioning them into the community, into sober living facilities, into substance abuse programs, and try to find them jobs when they come out, not just give them $200 and say good luck.
Right, and I know there are some programs, we've done a couple interviews about those that are going fairly well here. The 211, first of all, was the last one. Bunny, last question here. How is the county handling, how are you paying for the prison realignment, and how do you predict paying for if this influx comes in?
Well, we get money from the state for prisoner realignment. So we've added staff. Probation got the biggest hit because they needed more people really quickly. So we're using that money, but we're going to save money by virtue of the fact that those people that get the tools that the sheriff is talking about will turn their lives around and won't go back into jail, which is now local prison. So all in all, we know how to do it here in San Diego County. We just need to have the tools available to us to do it.
And it sounds like a little bit of time. So District Attorney Bonnie DeManis and Sheriff Bill Gore, thank you so much.
Thank you.
Thanks for having us.
Advocates for the developmentally disabled want the Governor Brown, to take action to improve safety at state-run care facilities. Last year, we brought you an investigative report finding a pattern of abuse and neglect at California's developmental centers. Today, advocates went to the Governor's office to demand an independent safety official oversee the centers. The state has already created a task force. It's expected to release a report in November. People suffering from serious mental illness such as schizophrenia often refuse treatment because they don't know they're sick. The county is reviewing the mental health services available to thousands of people who are resistant to treatment. Anita Fisher is an advocate for involuntary treatment programs. Her son, Pharaoh, suffers from schizophrenia. Last week, he was released from Donovan State Prison in the county, and he's been missing ever since. Here's her story.
About 14 years ago, my adult son was diagnosed with serious mental illness.
My name is Pharaoh Degree. I'm 32 years old and I have a co-occurring disorder. My mental health diagnosis is schizophrenia with substance abuse.
Prior to my son's, I always say his illness manifested, Pharaoh was a medic in the United States Army. He was actually stationed at Walter Reed Hospital, and as parents, we thought, wow, he's on his way. We have 2 sons and 1 down, 1 to go. And I have noticed over these 14 years that when he is untreated, he is very, very ill. But when he is accepting his treatment regime, he also does extremely well.
I am now certified to be a peer support specialist. I'm a peer-to-peer mentor, and I now work for NAMI as a peer helpline specialist. I just wanted to share my story with you all and tell you that with hope, God, and support, recovery is possible.
He oftentimes ends up on the streets homeless, and he ends up being arrested, goes to jail or prison. And as far as recently, he was just released a week ago, and we don't know where he is. And that has been one of the most, stressful times when we don't know where he is. And had I been able to get him involuntary treatment, outpatient even, I don't believe he would ever have gone back to jail this last time. So we end up in this situation where he's not connected to services. He just walks out, and he's probably on the streets, could be anywhere here in San Diego County. So I have to wait for now the shoe to fall again, is that he's arrested, and then I know where he is. I literally have who's in jail on my favorites on my computer, because every day I now have to check it a couple of times a day to see if he's been picked up. I would want to say to him, please call us. We only want to help you. We love you and we miss you.
Now, next week, we'll bring you a special series on navigating the mental health system in San Diego County. North County Transit District is set to vote tomorrow on a drastic change in the way it keeps its records. iNewsSource reporter Brad Racino joins us to explain what it's all about and what's at stake. So, Brad, what's the agency voting on tomorrow?
They're expected to pass a rather sweeping policy change tomorrow that would change how long the district retains certain emails. Up until now, the agency has kept them for 2 years. If this new policy is passed, it will drop down to 60 days.
And why is this important?
It's important because it'll damage the public's ability to hold this organization accountable. We at iNewsSource have relied heavily on the agency's emails to document issues of safety, management, service, turnover, and a bunch of other things throughout the course of our ongoing investigation. If this passes, certain memos or notes kept by employees will be limited to the last 60 days. The ones prior to that will be deleted. And they're leaving the decision of what is and what is not a district record to its 100 or so employees.
And why is the agency doing this?
They say it's because they're running out of storage room, but experts we've talked to say that's ridiculous this day and age. For example, I get 15 gigabytes of storage free with just a Gmail account, and the agency bought a $20,000 email archiver in 2010 for this very purpose.
What does the board say about this?
Well, once again, we tried to reach Chairman Bill Horn, but he didn't return the call. We did speak with John Aguilera, who sits on the board, and he couldn't give us a good reason for the change. He said it had something to do with complying with state standards or guidelines. We looked into that, and that's not the case at all, according to the Secretary of State's office.
I understand iNewsSource is taking a stand on this?
Right. iNewsSource is opposed to deleting government emails after 60 days. We've made it easy for the public to weigh in on this. If they go to inewssource.org/NCTD, they can actually click one button and send a generated email to all the board members to voice their opinion.
iNewsSource reporter Brad Racino. California's economy is getting better, but it means folks out of work stand to lose their final 10 weeks of federal unemployment benefits. That's because the national unemployment rate has dropped below 9% for 3 months in a row, and the long-term unemployed lose eligibility for the final extension. California loses its federal funding in mid-August unless Congress acts. When the Affordable Care Act fully kicks in next year, many people will access primary care at low-cost community clinics, but attracting doctors to those clinics is a different story. Speak City Heights reporter Megan Burke says a local health system is trying once again to change the status quo.
And what's the reason for your visit today?
I need a refill on pain medication, and I think I'm due for a mammogram.
It was in 1970, in October, and there had been sort of the height of the Chicano movement in Barrio Logan. The freeway had just gone through, which cut the community in half.
Castell, your 830 is the waiting area, please. Castell, 830 waiting area.
Do you want me to start over?
Sure.
Okay.
Finding a place at the Chase Avenue Clinic to ask Public Relations Director Jeanette Shea about Family Health Centers of San Diego's beginnings was a little tricky.
It was in October of 1970, and it was
Okay, I'll finish for her. A Barrio Logan grandmother named Laura Rodriguez took the keys for a building that was set to close, staged a sit-in, and demanded it be turned into a health clinic. It became Family Health Center's first facility. From that scrappy beginning, it's become the nation's second largest federally qualified health center, with 17 clinics throughout the county. Some of those clinics are brand new, state-of-the-art facilities. Back at the Chase Avenue Clinic in El Cajon, things are still a bit scrappy. Doctors share offices the size of walk-in closets. The conference room doubles as a break room. We're conducting our interview in a busy nurses' station.
I think it's just a lot of chutzpah, and that's sort of a characteristic of family health centers where we're just here to make it work. We're here to make sure our patients get access to care.
And it's that chutzpah that makes clinics like family health centers a cornerstone of the Affordable Care Act, which will grow the ranks of patients by 30 million nationally. They're good at doing a lot with a little.
It's been shown that we are one of the most effective and cost-efficient ways to deliver care. So if you look at the cost, it's about a third less to deliver care at a community health center setting and with the same high-quality results.
What they're not so good at is attracting doctors to come work for them. There are those closet-sized offices. There's also the challenge of getting med students with elephant-sized debt to go into primary care. The federal government estimates the nation is short about 16,000 primary care physicians. But Family Health Center's Assistant Medical Director, Chris Gordon, says there's something else at work.
Interestingly, literature shows that half of the physicians stay where they train. It's independent of what that setting type is. Half of them stay where they train. And I think probably part of that has to do with being comfortable in the environment that you learned in.
And where do the majority of doctors do their residencies? Hospitals. Finding a clinic accredited for residencies is rare, but that's changing under the Affordable Care Act. The health reform law has set aside $230 million to set up residency programs in community clinics. Locally, Dr. Gordon and family health centers are leading the charge. They're applying to bring 6 resident physicians into their City Heights facility next year.
Gordon and others are betting that if doctors start their careers in community clinics like this one, they'll stay in community clinics.
That was Gordon's experience. He came to family health centers 4 years ago after training in Riverside County health clinics.
I think the reason why most of us are working for family health centers is because we believe in the mission. We want to take care of the underserved. We're interested in assisting with bridging the gap of disparities in healthcare between those that have had insurance all of their lives and those that don't.
Gordon and Jeanette Shea insist they'll be ready when the Affordable Care Act starts to close that gap next year. There might still be a doctor shortage, but family health centers started with much less, an empty building and the chutzpah of a Barrio Logan grandmother. Megan Burks, KPBS News.
The federal government says mid-city, downtown, and southeastern San Diego have too few primary care doctors. It recommends 1 per 2,000 residents.
I'm Jeffrey Brown. On the next news hour, farmland seized by the government in the Asian nation of Myanmar. That's Wednesday on the PBS NewsHour.
This is preview night for the 43rd annual ComicCon. Volunteers and exhibitors were lining up today at the convention center to get their badges. ComicCon is San Diego's largest convention, and Peggy Pico has a look at what's new this year.
About 130,000 more people will be in downtown tomorrow for the first day of Comic-Con. Among this year's treasures, Yoda ears for your dog, original artwork featuring a zombie Jesus, and comic books that sell for $1,000. Joining me with more of what's ahead is Comic-Con's David Glanzer. Thank you so much for joining us.
Pleasure to be here.
Now, David, by now we're used to seeing stormtroopers at coffee shops downtown and various other icons on our trolley. What's new at this year's convention?
You know, it's always there's always new things happening. I think one of the things that's really exciting this year is we'll see a lot of video games. Video games seem to really be kind of making a big splash at the show this year. I know that one company has rented the Star of India and is actually putting it behind the convention center, and they're going to feature some new games and things like that. So it's going to be.
They're moving the Star of India.
Yep. In fact, it's behind the convention center right now.
Okay, well, that's one event, and this is a complete event devoted to pop culture, if there's ever been one. Who are some of the big names coming in on the panels this year?
Well, one of the excuse me, sorry. I'm so choked up. I'm so excited about it. Movie stars, television stars, the movers and shakers of comics and toys and games. We've seen a real big increase in television at Comic-Con. I think there's more genre-related television product, not only from cable channels, but from networks as well. So there'll be TV stars, movie stars. It'll be a lot of fun.
Are there any particular panels or that you predict will be the most popular?
It's funny because I think a lot of people go in, especially companies go in, hoping that their panel will be the standout panel. And we won't really know until Monday after the show, because it really will be up to the fans to tell us what they like the most.
Is there any particular one that's unusual to you, or one that you're most looking forward to?
There's actually a great panel that Sergio Aragonis does. It's called Quick Draw, and he is an artist who works with Mad Magazine and a character Gru, and he is so funny and is probably the fastest drawer in the West, and it's always a great time, a lot of laughter. It's a great panel.
Well, tell us about the TUCON blog, Comic-Con's TUCON blog. I know they've been posting tips for attendees. Give us some examples of what they're telling us.
Well, yeah, we had thought that it was a good idea for people who are coming down to have some idea of how best to enjoy their weekend. And the tips include, finding a place to meet. A lot of times people will come down and forget to arrange a time, and cell phone coverage may not be all that great at certain locations. So find a place to meet, wear comfortable shoes, stay hydrated, plan. Go to our website, look at the schedule. We have over 600 hours of programming. So, I think if there's a big thing this weekend, is plan ahead.
What about, is there an app? I understand there's an app.
There's a Comic-Con app that can be downloaded, and there's also a scheduling that you can download to pick your panels for the weekend.
Okay, I want to let folks know that Comic-Con does kick off tonight with a preview, but it officially runs Thursday through Sunday at the San Diego Convention Center. David Glanzer, thanks so much for talking with us.
Thank you very much.
Well, from Comic-Con to horse racing, it's back at Del Mar for the 76th year in a row. The highlight of the opening day is always the popular hat contest, judged for most outrageous, most glamorous, or funniest hat. Most of the horse racing takes place Wednesday through Sunday, and you have until September 4th to catch horse racing season at Del Mar. The Friday concert series will also continue with the B-52s performing this week. San Diego weather, look for temperatures in the 70s along the coast for the next few days, mid-80s for the inland valleys. Forecast has changed a bit for the mountains. No more predictions of thunderstorms, but the desert could see thunderstorms with temperatures above 100. You can find tonight's stories and download the KPBS app all on our website, kpbs.org/evening edition. Thanks for joining us. Good night.